Hello and welcome to our project. We focused on the effect of socioeconomic status on the mental health outcomes of Asian Americans residing in New York City. So for some background, Asian Americans suffer from the model minority myth, which portrays Asian Americans as hard workers who live in comfort and need no help to rise high, but never to the top. This may seem like a positive stereotype, but beneath the surface lies the truth. This myth ignores anti-Asian racism and presents Asians as a monolithic group, hiding cultural differences and preventing them from accessing help. This reality is clearest in New York City. Asian Americans residing there have a socioeconomic status, or SES, on par with Hispanic and Black populations within New York City, with about 1 in 5 Asians living below the poverty line. While it's studied that lower SES correlates to poorer mental health outcomes, it's not known whether this effect is true for Asian Americans, considering Asian American mental health is barely studied at all. Therefore, we ask the question, does lower neighborhood socioeconomic status correlate with decreased mental health in disaggregated Asian American subgroups residing in New York City?
For this study, we analyzed data from the New York City Community Health Survey in the years 2017 to 2020. We included all individuals from Asian American backgrounds and divided them into 3 categories: Indian, Chinese, and all other Asian Americans. In our study, the exposure variable is neighborhood SES, which is a way of describing an area based on characteristics such as its residents' education and average income. To create this variable, we use principal component analysis, or PCA, to create a linear combination of 4 neighborhood characteristics: unemployment rate, rent burden, education, and poverty rate. The PCA provided us with a value for each neighborhood that we further divided into tertiles. Our outcome of interest was mental health, measured by PHQ-8 and K6 scores. These scores are calculated from the results of 2 questionnaires that measure nonspecific psychological distress. For both variables, the higher the score, the lower the mental health of that individual. To complete our analysis, we used R and SAS to analyze the impact of SES category on mental health outcomes after standardizing by age and adjusting for confounders. We also ran tests to determine the statistical significance of our findings. This led us to the following results.
We concluded that neighborhood SES is correlated with the mental health outcomes of different Asian Americans living in NYC. Specifically, Asian Indians in the lower SES neighborhood experience poorer mental health outcomes than other Asian subgroups. This finding was statistically significant with p-value less than 0.05. Conversely, the Chinese population in the lower SES neighborhood experienced better mental health outcomes than other Asian subgroups. The results vary between subgroups, reinforcing the concept that Asian Americans and their mental health outcomes are heterogeneous. The limitations we had were sampling bias, omitting missing values, and aggregation of Asian groups other than Chinese and Indian due to their small sample size. We're excited that our results show interesting trends regarding the heterogeneity of Asian American mental health and hope to further research potential exposures that could have impacted our results. Lastly, we would like to thank our mentors for all their guidance and patience throughout this project. Thank you.